Thank you. Good afternoon and welcome to our media briefing to kick off the 2020-21 flu season. My name is Heidi Parker. I'm the Executive Director of Immunize Nevada, a statewide nonprofit that promotes health and prevents disease. Today you will hear from a variety of leaders and public health representatives, our governor, the Board of Health Vice Chair, our Chief Health Officer, the Nevada Minority Health and Equity Coalition, and the UNLV School of Medicine. They are committing to lead by example to protect Nevada by preventing influenza, especially in our communities that are at the most risk and most vulnerable to complications from the flu. We ask that all healthcare, business, education, community, and other leaders do the same. You will also hear today how the flu vaccine is more important than ever during this pandemic. We can all arm ourselves with a safe and effective vaccine while we continue to stop the spread and flatten the curve of COVID-19. We are grateful for the governor's leadership and for rolling up his sleeve to protect himself, his family, and his community. So without further ado, Governor Sisolak. Thank you.
Thank you, Heidi, for those kind words and for the introduction and for your work with Immunize Nevada and the Southern Nevada Health District to organize this important event that we're here for today. Today, I'm here to remind all Nevadans of the importance of getting a flu shot. This year, more than ever before. As we continue to work to slow the spread of COVID-19, a flu shot is a powerful tool to help make sure we are all staying healthy. Getting a flu shot helps protect you from the flu, and it helps protect our healthcare system, which are continuing to treat COVID-19 patients. We want to ensure that our healthcare system have enough personnel, equipment, and capacity to treat all patients, and by getting a flu shot, you are doing your part to help us in that effort. If all Nevadans get a flu shot, we can help keep thousands of patients out of the hospital this season. And that will be a critical step to helping our state and our doctors and nurses who have been working around the clock since March. That's over 6 months, helping us fight the COVID-19 pandemic. We owe them all an eternal debt of gratitude for their efforts on the front line. We do not want to see a huge surge in flu cases on top of COVID-19 cases, overcrowding our hospitals and preventing Nevadans from getting the care we need. Flu shots are easy and they're painless. And today, my wife Kathy and I both will get our flu shots to ensure we are protected this flu season. The CDC and our own public health officials recommend that everyone 6 months and older get a flu shot every year. I certainly qualify in the 6 months or over. If you have questions about what kind of flu shot to get and what is right for you, please talk to your doctor or other healthcare professional to get their advice and opinions. Finally, I know we're here today to talk about the importance of a flu vaccine, but I also want to take a moment to remind Nevadans that COVID-19 is still among us, and we need to remain vigilant more than ever. Please, if you were out and about this Labor Day weekend in a large crowd or with people from outside of your household, please get a COVID test. Even if you have no symptoms today, please go get a COVID test. The more people we test, and right now we have the Stop, Swab, and Go available, the more people we test, the more we can do to bring positivity down. If you want to attend a theater, if you want to attend the movies, if you want our restaurants and bars to open back up, if you want to be able to go to a Golden Knights game or Raiders game, we need to bring our numbers down. You getting a COVID test help us accomplish that goal. And I implore you, everyone who has not gotten one, to please avail yourself of the opportunity and go get a COVID test. Clark County surge testing, called, as I said, Stop, Swab, and Go, is now on until September 18th, an extension of almost a full week. That's in addition to the regular testing sites that are available in Clark County. Nevadans across the state can visit the Nevada Health Response website at nvhealthresponse.nv.gov to find a testing locator map to find a site near you. I also want to encourage everyone to sign up for the app on your phone. Nevada Test, I should look up the name of it here. COVID Trace. If you put it on your phone, it will help drastically for us to be able to trace contact with someone who might have been positive. It takes no effort. It's free. If you go to the App Store to COVID Trace, put it on your phone, and it'll help our healthcare professionals trace who you might have been in contact with, who might have been in contact with you unknowingly, and you might have been exposed, and will prevent the disease from spreading. So I encourage you first to go get a test at Stop, Swab, and Go or one of our other sites, and to put COVID Trace on your phone on that app. Thanks for coming, and I will now turn it over to my friend and colleague from the Clark County Commission, Chairwoman Marilyn Kirkpatrick. Commissioner.
Good afternoon, and thank everybody for coming today. And I apologize, my voice is a little bit groggy. That wind's a little bit rough out there today. But first and foremost, this really is a pleasure for me as a Southern Nevada Health District board member. I serve as the vice chair of the Health District, and this is really what we do every single year, is we remind people to get out, to get your flu shots, stay healthy. I carry my hand sanitizer with me all the time. We remind the little ones to wash their hands diligently. If you have a runny nose, be sure to stay clean and stay hydrated. But today really is about what we do as a public health agency, and that is encouraging people to get out and get their flu shots to get ahead of it for this fall season. Secondly, we do immunizations for all of our little ones, and as the governor pointed out, we encourage people to go get their COVID-19 testing, because the more that we can have people test, and that's your whole family, from your smallest one to your oldest one, and encourage them to get testing, because that's how we stay on top of the spread. But today, encourage everybody to go out and get your flu shot. I am going to be getting my flu shot with the governor and the first lady today. So do your part for our community. Stay healthy as we go into the fall, and we will all get our flu shots, and they're available across the valley. So with that, I'm going to turn it over to Dr. Fermin Lagun. Dr. Lagun.
Thank you, Commissioner Kirkpatrick and Governor Sisolak. The Southern Nevada Health District wants to remind everyone about the importance of the flu vaccination. Every year we do a lot of work with the flu vaccine here in the county. We partner with multiple groups. Also, we have a mobile unit that go to multiple places across the county, and we offer that vaccine. We also receive a certain amount of free flu vaccine for adults and children that we distribute across the county. I also want to mention the importance of the flu vaccination this year, especially when we are still fighting the COVID pandemic, and the risk of having both the flu and COVID hitting our communities, especially for those members of our community who are suffering other diseases or conditions such as diabetes, immune depressive conditions, some sort, cancer, HIV, and other depressive conditions that actually put them at risk of suffering severe complications from both the flu and COVID. So if every year is important to have the flu vaccine, this year is even more important. You want to say that. We also want to mention that the Southern Nevada Health District will be offering the flu vaccine at this facility and also our facilities in East Las Vegas, Henderson, and other sites across the county. And our mobile unit will be offering the vaccine at multiple locations. We have an agreement with county libraries in Las Vegas and Henderson and other areas where also we go and offer the vaccine. And just in closing, I want to say, I remember everybody that the flu shot saves lives, and especially this year, it's not just about the flu, also it's about COVID, and making sure that our loved ones are not affected by any of those diseases. Thank you.
Good afternoon, everyone. My name is Jose Melendres, and I am the Executive Director for the Office of Community Partnerships at the UNLV School of Public Health, and I also currently serve as Chair of the Nevada Minority Health and Equity Coalition. We are committed to supporting the public health system in Nevada that is inclusive and mindful of all diversity and equity populations, and that is the kind of effort that we need right now to make sure that we're involving everybody in this effort to get their flu shots. We support the public health system and those who lead it to recognize and respect the economic, racial, and social impact in our communities. I want to take this opportunity also to thank Governor Sisolak for his leadership and courage in declaring racism a public health issue. We appreciate that, Governor. Thank you to Heidi from Immunize Nevada and Governor Sisolak for inviting me here today to share this critical message about immunization. Like our leader of the health district, we all know that healthcare is a barrier in getting an annual flu vaccination, especially in our vulnerable populations. We know that these communities have increased rates of diabetes, hypertension, cardiovascular disease, kidney disease, and other underlying health conditions that leave them more susceptible to severe illnesses associated with influenza. Especially during this challenging time that is more compounded by the COVID-19. In addition, these populations are overrepresented in settings serving on the front lines as essential workforce positions, thus increasing their exposure in the current pandemic. Numerous studies show that African American and Latinos, as well as Native Americans, Pacific Islanders, LGBTQIA, and others are impacted and need to be vaccinated for the influenza shot. The UNLV School of Public Health and the Nevada Minority Health and Equity Coalition support the efforts of Immunize Nevada and the leadership of Governor Sisolak to encourage all Nevadans to get their flu shots this season. If not for yourself, then do it for the ones you love. Be safe and stay healthy. And I did get my flu shot 2 weeks ago, so thank you.
Good afternoon. My name is Jabri Milan. I'm a second-year medical student at the University of Nevada, Las Vegas School of Medicine, as well as co-president of our chapter of the Student National Medical Association. The UNLV School of Medicine and the SNMA are committed to graduating socially and culturally competent physicians who can tend to the healthcare needs of our diverse population here in Nevada. Thank you, Immunize Nevada and Governor Sisolak, for having me here today. Like Mr. Melendres, I want to make a few points about vaccines and healthcare access for minority groups. Access to healthcare is an identified barrier in getting an annual flu shot, especially in our minority and impoverished populations. During the 2018 and 2019 flu season, only 22% of our black population and 36.2% of our Hispanic population received flu shots. We're implementing innovative, evidence-based strategies to address these inequities in flu vaccinations and make this a public health priority. However, this is a multifaceted effort, and we need the help of community leaders and the general public. I'd like to share a story of my personal experience administering flu shots in the community. For the past few years, students from the UNLV School of Medicine, with the help of additional community healthcare professionals, have hosted free flu shot clinics at the Agassiz Boys and Girls Club. The club is located in West Las Vegas, where health services are few and far between. In our 2019 clinic, we administered about 75 flu shots to parents, children, and other community members in about a 4-hour span. This was a huge success that was mostly attributable to gaining the public's trust through education and working alongside great community leaders. We created a flyer that stressed the importance of receiving a flu shot, and we took the time to educate those who arrived with questions. However, some people were still apprehensive. The Agassiz Boys and Girls Club is led by Mr. James Smith, someone I personally hold in a high regard, and I know many other community members feel the same way. Mr. Smith volunteered to get his flu shot before everyone else. After witnessing Mr. Smith receive his shot, the kids and their parents became more receptive to receiving their own. We also made it a point to give parents their shots before their children to provide another example of someone they trust doing the right thing. When people arrived later in the clinic, Mr. Smith would show them his Band-Aid and assure them that it didn't hurt. Like Mr. Smith and Governor Sisolak today, we all need to embody the change that we wish to see around us. Healthcare professionals will continue to do their part to promote public health, but we also need community leaders to rally around and champion our public health initiatives. Business owners, managers, teachers, coaches, heads of households, and all other community stakeholders, we need you to get a flu vaccination this fall and encourage those around you to do the same thing. Stay safe, Nevada. Thank you.
Thank you to all of our speakers that joined us today. Just that reminder of all Nevadans can do their part to help protect our state, our community, their families. And Governor Sisolak is going to now get his flu shot along with the First Lady and then some of our other speakers as well today. So thank you all for being here, and then we'll transition over to the area of flu shots. Thank you.
Absolutely painless. Thank you. Sure, Eric, come on up. After you. You're smart. You think ahead. Wear a short sleeve shirt when you come get it done. It's in the leader, I guess. I just announced it's her first time getting a lot of credit. I guess they wanted me to ask if anybody had any questions while you've got us gathered here. Does anybody have any questions? Jeff's always got a question. Okay. Yes. It's a big concern that we have, and I'm confident that with the work that the health district is doing and collaborating with the county, who I give an awful lot of credit for getting out front on this, if we can just educate people, it's painless, the flu shot, absolutely painless, and it will protect you, especially, hate to say it, as you get a little older, like me, not so much my wife from Maryland, but as you get a little older, it's important that you protect yourself every way you possibly can. So it's definitely beneficial, and our frontline workers, our nurses, doctors, hospital staff, medical students have been doing, the health district have been doing incredible work for better than 6 months now, dealing with COVID-19. And the last thing we need to do is overwhelm a healthcare system with the flu epidemic. So it's an easy thing to do. It's something you can be proactive on. I encourage everybody to do it. I do attribute it to some of the protocols we've put in place, and I commend the county for their help in enforcing some of the mandates that we put in place. The idea of wearing masks, avoiding large gatherings, social distancing, washing your hands, keeping safe, is definitely helping us to bring the numbers down. And the COVID Track app on your phones is helping us identify new cases. We're really excited about the Stop, Swab, and Go, that we can test more people. The more people we test, the more we'll be able to bring our positivity numbers down, and the quicker we're going to be able to get to opening things. So we're hopeful that the numbers continue to come down. We just got through Labor Day weekend, and hopefully we'll get through without any major hiccups along the way, but that's our hope. Yeah, the flu shots are made available free if you don't have insurance to pay for them. I mean, as the medical students saying, we went into the minority communities and went into Agassiz Boys and Girls Club, and that's great. We need to get our mobile units into those areas to provide them for folks. Sometimes people, if you haven't gotten one before, you're a little intimidated, but there's no reason to be intimidated. It's a very simple process, and we'll do a big outreach into our African American community and our Hispanic community to make sure that they have available and they know they're available. Anybody else? Thanks, everybody.